My name is Vanessa Ferreira. I'm president and founder of the Portuguese Association for CDG, Congenital Disorders of Glycosylation and Other Rare Metabolic Diseases. I'm as well member of the Spanish Association for CDG, and I'm a Euroglycanet CDG representative at the European Platform for Rare Diseases Registries, APRARE project. Hereby you can find the different parts of my presentation. First of all, I will talk about rare diseases, a small introduction about this subject. Rare diseases has a public health priority, and finally about the patient's voice. In this part we will find different parts, which are one part about the APCDG DMR, a non-profit organization, congenital disorders of glycosylation, which is one of our diseases that we represent. And finally, we will talk about the different activities that our non-profit association undertakes at the level of supporting families, networking, awareness amongst public and healthcare professionals. Then I will talk about activities in education, at the education level, and finally I will talk about the activities that we undertake at the level of scientific and medical research. First of all, about rare diseases. What is a rare disease? A rare disease in Europe is a disease affecting less than 1 in 2,000 citizens. In the United States, a rare disease is a disease or condition affecting 1 in 1,500 people. Interestingly, in Europe, even if one rare disease individually affects a small number of people, we have to think that in global, rare diseases in Europe are affecting 29 million people. For example, in Spain, there are 3 million people affected by a rare disease. As well, in France, there are 3 million people affected by a rare disease. In Portugal, we estimate that there is almost 1 million people affected by these rare conditions. In the United Kingdom, there are almost 4 million people affected by a rare disease. And finally, in Netherlands, there are 1 million people affected by these pathologies. Finally, in the United States of America, there are 25 million people affected by rare disease. We know nowadays that there are between 6,000 and 8,000 different rare diseases. Hereby in this slide you can see different names of different rare diseases, and the number of scientific publications about rare disease is increasing. All rare diseases, they share common characteristics. In one hand, they are chronic, they are progressive, sometimes they are degenerative, they are life-threatening, they are disabling. We can find as well patients in which there is a lack or loss of autonomy, and these diseases are very difficult to manage. On the other hand, patients are few and they are spread worldwide. Research is fragmented, resources are limited, experts in rare diseases, they are few, specialized centers to each rare disease, they cannot exist, and finally, relevant information is little. Concerning the origins of rare diseases in general, they have different clinical manifestations. They have different causes, they affect different population, and they can present different degrees of severity, and they can appear in different age of onset. 80% of rare diseases, they are genetic, and 20% of rare diseases, they have a non-genetic origin. They can be due to bacterial or viral infections. They can be due to allergies, environmental causes, and they can be degenerative or proliferative bases. Concerning the second point of my presentation, rare diseases has a public health priority. It is important to keep in mind that currently rare diseases, they are in the agenda of politicians in Europe, and there are different European regulations on orphan drugs, for example, pediatric use of medicines, advanced therapies. There are as well European regulations on Commission communication. There are as well different regulations from the Council recommendation on rare diseases. And finally, and very important, last year an European directive on cross-border health care established rare diseases as a public health priority. Hereby you can see the link of this last European directive. Concerning orphan medicinal product regulation, we have to take into account that the development of orphan drugs targeted to rare diseases, the costs are much higher than the expected return on investment. Nowadays, we know that there are almost 8,000 rare diseases, although only 300 rare diseases have a treatment available so far. So this orphan medicinal product regulation has different incentives in order to boost the development of orphan drugs to these conditions. In one hand, there is market exclusivity, which means that for 10 years after grant of European marketing authorization, there are as well fee reductions. There is as well a centralized procedure. There are as well European funded grants, and finally there is a protocol assistance, which is a free scientific advice that can support these orphan drug designations. Finally, in order to apply for an orphan drug designation, it is needed certain criteria. In one hand, it has to be proven that this disease is life-threatening, that the prevalence is less than 5 in 10,000 citizens, and that there is no satisfactory method existing or medicinal products so far. Concerning the annual number of orphan designations and marketing authorization, you can observe in this graph that during the last years the number of orphan drug designations, they have increased, and as well the marketing authorization for these orphan drug products. And concerning the number or the percentage of orphan medicinal products on the market, you can observe in this graph that 22% of orphan drugs, they are destined to diseases that are related to metabolism, and 38% of these orphan drug medicines, they are anti-neoplastic and immunomodulating agents, for example.